No.
Okay, here's my 7 people. This is Lucy, Pat, Karen, Tara, Natasha, Debbie, and Stacy. And then Tara's going to be our camera person here. Alright. So the purpose of this is to demonstrate how to check a patient or a person's vital signs. So what we're going to cover today is how to take a blood pressure and a pulse. That's the 2 most common. So the things you need: stethoscope, sphygmomanometer, otherwise known as a blood pressure cuff, and a watch. You need one with a second hand so you can check a pulse. So the first thing to do when you check someone's blood pressure is, I'm going to borrow your arm. I'll let you slide this way a little bit. You want to, the first thing you need to make sure you have an appropriately sized cuff. There's child, adult, and a large cuff. So if you have one that's too small, you're not going to get an accurate reading. So you want to make sure you use one that's appropriate size. So the first thing is you're going to put it above the arm. There's several other places you can check: below the arm, in a leg. This is just kind of the standard, the most common. So what you're going to do, you'll have it above the arm here. You kind of move these tubes out of the way. And you just kind of want to gently inflate it with just a couple quick breaths. And you don't want to go, usually about 160 is fine. Some people you need to go up higher. That's kind of the standard. So then you have your stethoscope. You want to place it sort of right above the elbow crease, right below the cuff. Just following my notes here. Right below the cuff. Then what you want to do is just slowly release the valve. And what you want to listen for is kind of a sort of a thump, or a sort of a blurp sound is what you're going to hear. So that's the first thing you're going to listen. Now the first one you hear is going to be your, what they call your systolic blood pressure. If I'm not squeezing your arm here. Is your systolic blood pressure. That's the top number. So that's the pressure as the blood is pumping out of the heart into the body. So then what you want to do is you slowly just want to release until you keep hearing a couple of those little thumps again. Then the last thump you hear, that's the one you want to take note of too. That's going to be your bottom number, your diastolic number. So I'm going to go ahead and let that out so we don't make your arm go numb. So the diastolic number is the blood as it's entering back into the heart from the body. That's your bottom number. So what you would do is you take your systolic number, your top number, which goes over your diastolic number, which is the bottom number, and that gives you your patient's blood pressure. So I'm going to take this off over here. Normal for normal adult used to be 140/90. Now a lot of doctors are saying 140/80. That's kind of the standard. So anywhere around there below that's considered kind of the normal. So that's basically the how-tos of how to take a blood pressure, just in kind of simple steps here. The second thing we're going to cover is how to take a pulse. So what you want to do, there's a couple of things here. This is really easy, but there's a couple of things you want to do. You want to locate sort of the crease of the wrist here. You want to go below the thumb. There's other places you can check it, in an ankle, carotid artery here. This is kind of that standard practice. You always want to use either your index or your index and middle finger. I do one, some people do two. Good rule of thumb is don't use your thumb. That's how I remember, because a lot of people, you have a pulse in your thumb already. So that can kind of confuse your pulse with somebody else's. So you want to be careful about that. So what you'll do is you want to place your 2 fingers here, and you've got a good one, so I can figure it's great. And this is where your watch with the second hand comes in. Some people are pretty faint. You have to kind of feel around and roll around here, but yours is pretty easy. So what you want to do is you want to count for 15 seconds how many beats you feel. So we'll count here, and I feel we'll start when I get to an even number here. So we'll go 1, 2, 3, 4, 5, 6, 7, 13, 14, 15, 16, 17, 18. Okay, so 18 is how many we counted in a 15-second interval. So what you want to do is you want to multiply 18 by 4, because there's 4 15-minute segments in a minute, or 15 seconds in a minute. So that's going to give us 72. So that's going to be your pulse rate of 72. And what this is measuring how many times your heart beats in 1 minute. So normal for most adults is usually 60 to 100. Some kids are rating it a little bit higher. If you've been exercising, Sometimes it's obviously going to be a little higher if you've been running, jumping, things like that. Stressed out, your pulse is going to be higher, but normal for your average adult is going to be 60 to 100. So that's basically how to check a pulse. So those are the two most common vital signs: blood pressure and pulse. It's really easy as long as you have the proper tools, a couple of little basic know-hows and know what to do. So that's really it. Anybody have any questions, or it's pretty simple? All right. Okay. Well, thank you guys.
Thank you.
Thank you.
Yay.